So in this video, we'll talk about the ducts within the testes, and we talk about how from the seminiferous tubules, how sperm can start to be transported towards the epididymis through our root testis here. And then from the root testis, we have our efferent ductules that connect the root testis to the epididymis. The epididymis was a storage site for sperm. You find it on the posterior superior part of the testes, and it has a head, a body, and a tail. The head is the widest portion, that's the most superior. The body's the middle, and the tail is the inferior portion that's also very thin, but connects with the vas deferens. So internally, the epididymis has a long, convoluted duct that basically stores sperm and essentially serves as a maturations process for sperm as well. So spermiogenesis can continue within the epididymis. Now, in Ductus Deferens, this is effectively the muscular tube that carries sperm from the epididymis up through the spermatocord, through the inguinal canal, into the pelvic cavity, where then in the pelvic cavity, it actually goes back behind the urinary bladder, where Ductus Deferens then approaches the prostate. Now, near the end of vas deferens or Ductus Deferens, we have an ampulla, which is sort of a widening of the Ductus Deferens, and it's at this ampulla that unites with the proximal portion of the seminal vesicles. Remember, the seminal vesicles were these paired large glands in the posterior part of the bladder. Well, the ampulla of the vas deferens or Ductus Deferens converges with the seminal vesicles to form what we call the ejaculatory duct. So what happens is testicular fluid in vas deferens mixes with seminal fluid you find in the seminal vesicle in the ejaculatory duct, which then actually forces that fluid into the prostate. So the ejaculatory duct is formed by the uniting ducts of vas deferens and the seminal vesicle. And, bless you, it's located in the substance of the prostate gland. It's 1 to 2 centimeters long. And it basically conducts sperm from the vas deferens to the prostatic urethra. Bless you. Now, the urethra, it's one of its roles, outside of the urinary system, is to transport semen, and it helps carry that semen out of the body during ejaculation. Now, the male urethra we can divide into 3 regions. We got our prostatic urethra, membranous urethra, and our spongy urethra. And it turns out that as semen moves across the urethra, it's modified in the sense that new secretions are incorporated into semen before it leaves the body. Now, the accessory glands that are associated with the urethra effectively help contribute to the volume of semen. And we call this seminal fluid, which is what they create. Now, these secretions that are made by these accessory glands basically help nourish the sperm and also neutralize the acidity of the vagina. And there's 3 major glands here, like the seminal vesicles, the prostate gland, and the bulbourethral glands. Now, the seminal vesicles you find in the posterior part of the bladder. Prostate gland is the walnut-shaped organ on the inferior part of the bladder. And the bulbourethral gland was right by the urogenital diaphragm, which is by the membranous urethra. So the first one we'll talk about here, you guys, is the seminal vesicle. It's a paired glands that are located on the posterior surface of the urinary bladder, just lateral to the ampulla of the vas deferens. Basically, the seminal vesicles make a viscous, whitish, yellowish type of fluid that's also alkaline, so it's more basic. It also contains fructose as well as prostaglandins. The function of fructose here is that it provides sperm with energy. Fructose can be converted to ATP that the sperm can use to power their flagellum, which is used for propulsion. And what's interesting too here, guys, is that prostaglandins in seminal fluid stimulate vaginal peristalsis. So what's weird here is that the prostaglandins that are incorporated into semen actually stimulates muscular waves of contraction that actually helps draw semen closer towards the cervix, which is interesting and kind of gross. Now, where you find these seminal vesicles or seminal glands is just on the posterior part of the bladder here. Remember, they make seminal fluid. So the majority of seminal fluid is basically a viscous, whitish, yellowish type of fluid that's alkaline, so it's more basic. And the whole point of it being alkaline is you want to neutralize the acidity of the urethra and neutralize the acidity of the vagina. That way you prevent damage to sperm cells. What was the function of prostaglandins that are made by these seminal glands? You got it. They initiate vaginal peristalsis. So what's also interesting to you guys is that the prostaglandins you find in seminal fluid also help to weaken the cervical mucus. So prostaglandins also make the cervical mucus less thick, more watery, therefore it's easier for sperm to wiggle through the cervix. Now, these are the seminal vesicles back here, guys. They produce about 70% or so of the volume of semen. So most semen volume comes from these seminal vesicles. But when they converge with the vas deferens here, they form an ejaculatory duct that then goes into the prostate. And it's the prostate that makes prostatic fluid. And prostatic fluid, like seminal fluid, it's basically part of the volume of semen. It's slightly acidic because it contains things like citric acid, which is a nutrient for sperm. But it also contains mucin. Mucin is a type of glycoprotein that actually helps to make watery solutions more mucousy, kind of thick. It also contains seminal plasmin, which is actually antibacterial. That kind of makes sense from the standpoint of protecting sperm. Now, what's interesting too, guys, is that the prostate gland produces an enzyme called prostatic specific antigen, or PSA. Now, prostatic specific antigen, it's an enzyme, but it's also an antigen used to measure prostate growth. So you guys may ever hear about people's PSA levels, when they're checking for things like benign prostatic hyperplasia or even prostate cancer. You can look at PSA levels as a marker of how active and large the prostate is. But PSA is an enzyme, although it is a clinical significant marker. Now, this enzyme, strangely enough, actually liquefies semen. Now, because semen contains fibrin, that actually kind of forms a semen clot. So when semen leaves the male body, it can actually form a clot, and it forms a seminal clot. And the purpose of the clot is that it's harder for it to escape the vagina if it's all clotted up, right? Now what happens though is that PSA, which is actually an enzyme made by the prostate, as an enzyme, it actually liquefies that semen, and it breaks down the clot, which can actually help liberate some of the sperm, so the sperm can actually wiggle around, right? So it reverses the action of the semen clot, and it liquefies semen. That's its function. That's the function of PSA, which is made by the prostate. Now, the bulbourethral glands are these paired glands you find by the membranous urethra. And now, what's interesting, you guys, is that these bulbourethral glands produce a mucus-rich secretion that also helps to neutralize the urethra, and it's located near the base of the penis. Now, semen is just a mixture of the 3 accessory gland fluids, right? So it's a mixture of fluid from your prostate, from your seminal glands, and your bulbourethral gland. And when released, semen is called ejaculate. And ejaculate is typically about 3 to 5 milliliters in volume. And, this cap on this spray bottle is about 5 milliliters. So, that's the typical volume of semen, No, cap, not cat. Yeah, the cap right here that I'm holding in my hand. This is about 5 milliliters right here. So that's like an average volume of semen. But within this, although it's this small, 5 milliliters, right? Within that contains 200 to 500 million sperm cells. So there's a tremendous amount of cells within that fluid, and there's actually significant cutoff values here. It's not true that you only need 1 sperm to fertilize an egg. It's actually the activity of millions of these cells that work together to digest the outer coating of the egg. That way, one of the sperm cells can slip through. So actually, it turns out that it's a cooperative activity of many sperm cells, not one. And so there's certain cutoff values for fertility. Like if males make only 100 million sperm rather than 200 million, they're considered less fertile, maybe even infertile. So it's interesting. You actually need many hundreds of millions of sperm just to be fertile, which is surprising. But considering that males make millions of sperm every minute, it's not surprising that you can find about 200 to 500 million of these, in every ejaculate. So that's a lot of sperm. That's a lot of cells. Now the penis is the organ of copulation, and it's part of the external genitalia. Now the penis is analogous to the clitoris in females, so it's considered erectile tissue. And the penis has several key areas. We got our root, which is kind of deeper near the perineum, and the bulb, which are kind of near the crux of the penis. Now, the body is the shaft, and that's the elongated central region, which is external. And then that leads into a glans, which is the tip of the penis. Now, the glans is like the head, and that's in the center of which typically has a urethra. However, there are some certain congenital anomalies where the urethra may not open up at the glans. Typically the urethra should open right in the center of that glans, right? Now, in some individuals, sometimes the urethra opens up in a different area. Like there's actually a recent report that apparently Hitler had hypospadias, which is where the urethra opens up on the underside of the penis. That's one of the things he had. He also apparently only had one testicle. And they know this because they were able to dig up some legitimate medical documents where these records are out there, right? So it's kind of interesting. Maybe that's why he was so crazy. Yeah, exactly. But typically the external urethral orifice opens up and the glands of the penis. So remember, the external urethral orifice opens up right here, that's the opening of the urethra. We have our glands of the penis, which is mostly corpus spongiosum. We have our body, which is corpus cavernosum and corpus spongiosum. Then we have our crux of the penis, which is a little deeper here near the perineum. Now, if you look at the penis in cross-section, what we find is, yes, you got an outer layer of skin, a deeper layer of subcutaneous tissue and fascia, but then even deep to that, we have our erectile tissues. Now, we have two paired corpus cavernosum. And basically, the corpus cavernosum and other erectile tissues like our corpus spongiosum that surrounds the urethra, these erectile tissues are large venous reservoirs. So during an erection, what happens is you get an increase in blood flow to these erectile tissues, which then they fill up with blood, but then you also get a decrease in outflow. So by increasing the inflow of blood but decreasing the outflow, then blood starts to engorge and fill in those spaces, and that's what creates an erection. So there's no bone in a human penis. However, there are some bones in other male mammal penises, right? So some other mammals have bones in their penis, but males don't have. Human males don't have bones typically in their penises. But what makes it harder, during erection, is actually the engorgement of blood within these erectile tissues. So it's interesting. Now, corpus cavernosum is right here, and corpus spongiosum is actually what surrounds the urethra. So the purpose of corpus cavernosum is actually just to contribute to the majority of the erection itself, to make it stiff, because this is an organ of copulation. And it makes sense. I'm not going to go into gruesome detail, but you know what I'm talking about. So then, surrounding the urethra, then you guys have the corpus spongiosum. And the purpose of the corpus spongiosum is it keeps the urethra patent or open. If you didn't have anything supporting the structure of the urethra externally, effectively what would happen then is that during an erection, the urethra could get smushed and, it could be so closely, could be closed down so tightly that nothing could leave, right? But what happens, due to pressure, exactly. So then what happens then is what we have then is actually erectile tissue that surrounds the urethra, and it keeps the urethra open or patent. That way semen can actually leave the penis. There are some large veins on the dorsal surface of the penis here too, guys. And unfortunately, that's a common site for IV drug use. People like to inject IV drugs there. I know, it's gross. What's also unfortunate too, well, when you're an addict though, you'll do anything to get high. What's also unfortunate too, you guys, is that because they'll typically reuse needles and those needles aren't sterile, that's also a route of infection. So you see a lot of penile infections from IV drug users that inject in the penis. Yeah, like abscesses in the penis and stuff. And that also increases the risk of STIs, right? If you have large wounds on your penis, obviously it's going to be easier to transmit, transmit different diseases. So we find that, you guys, is that on the shaft of the penis we have our corpus cavernosum and our corpus spongiosum. Remember, the corpus cavernosum is dorsolateral and it's involved with engorging with blood and contributing to the majority of the erection itself. Corpus spongiosum is what surrounds the urethra, and the glands of the penis is also made of corpus spongiosum. Now, in females, the clitoris is actually corpus cavernosum, but they're both erectile tissues, and so they both engorge with blood during sexual excitement. Now, what happens during an erection, you guys, is that we get an increase in blood flow to those erectile tissues. So the erectile bodies, like corpus cavernosum and spongiosum, are venous spaces, and they basically fill in with blood during an erection. And what happens here is that due to the increase in the parasympathetic response, so parasympathetically, remember rest and digest? It's the parasympathetic nervous system that actually stimulates an erection. Parasympathetic. Yeah, I know, right? So remember we learned about how there's the 3 F's. Remember, fight, flight, fornicate. However, it's actually parasympathetic nervous system that stimulates an erection, but it's the sympathetic nervous system that stimulates an ejaculation. So I had a student once recommend that instead of calling it 3 F's, fight, flight, fornicate, it should be fight, flight, and finishing. But it wouldn't make sense unless you explain what that means, right? So I leave it at fornicate, and I know I don't spill the beans until this slide, right? So, so it's actually the parasympathetic nervous system that's involved with stimulating an erection, and the way it works is that the parasympathetic nervous system stimulates the production of nitric oxide. Remember, nitric oxide, it's a potent vasodilator, and if you vasodilate, then you decrease resistance, which increases blood flow. So that's what actually increases blood flow to the erectile tissue of the penis during an erection. But this is also why, in order to have an erection, males would need to be more relaxed, if that makes sense. If they're stressed in any regard, like sympathetically active, then they might have difficulty getting an erection. So you guys hear about like performance anxiety, where maybe like males feel like stressed about their own performance, and they have difficulty achieving an erection because of that stress. So relaxation is important in that process. Yeah.
So a lot of like pre-workout supplement drinks contain nitric oxide as a vasodilator.
Yeah.
Why aren't all the guys walking around the gym having a little bit more of a problem?
It's a good question. So the question was like, some pre-workout drinks contain nitric oxide, to increase blood flow to muscle, presumably. The problem with those is that if it's a drink, you have to absorb the nitric oxide, right? So I think one of the bigger questions is, if you are drinking nitric oxide, how much of that is absorbed? And for that is absorbed, how quickly is it broken down? Because there are enzymes that actually break down nitric oxide, and so it may not be absorbed in the body. However, though, based on this example, you should expect if someone is taking a lot of nitric oxide, it should promote an erection. Although I have heard about that, people like males getting erections while they're working out. And it could be because they're producing a lot of nitric oxide to increase blood flow to muscle, but also increases blood flow to the penis. A lot of it's psychological, yeah, because the parasympathetic nervous system relates to hypothalamic function, which is the emotional responses to things, and so there is some psychological factors too, you guys. However, ejaculation is actually a sympathetic response. So it takes a parasympathetic nervous system to cause an erection and a sympathetic nervous system to stimulate an ejaculation. Okay. So what happens during an ejaculation then is effectively the sympathetic nervous system stimulates rhythmic contractions of smooth muscle within the vas deferens and along the urethra, and it helps propel semen out of the epididymis to the penis and beyond, right? Now, what's not in your textbook, although it's kind of funny though, semen leaves the penis at approximately 14 miles an hour. So apparently someone had to measure this once, right? So I don't know if they had like a radar gun or something, but they found on average it's about 14 miles an hour. So it's kind of interesting. And it's the sympathetic nervous system that stimulates ejaculation.